If you are here, you have taken an active role in bettering your life, no matter what stage of life you are in. The Banyan Treatment Center's podcast will discuss many topics like recovery, addiction, self-help, mental health, and so much more. It will provide you with tools to succeed, ideas for recovering, and how-tos on creating a better life. My name is Alyssa, and today's episode is about receiving psychiatric care for mental health. Today on our panel, we have Andi Plotkin and Marie Hankins. Marie is a psychiatric nurse practitioner who specializes in treating complicated and uncomplicated depression, anxiety, and ADHD using medication and/or alternative treatment options. Andi is diagnosed with bipolar disorder, ADD, mild anxiety, and currently receiving care for these conditions. Today, they represent the population of patient and provider, and we are very excited to discuss the topic with them to help families that might be considering receiving this kind of care. Thank you guys so much for joining us today. Why don't you tell us a little bit more about yourselves and how you relate to this topic? Marie, we'll start with you.
Hi, so I'm Marie Hankins. I am the owner and psychiatric nurse practitioner at Mind Spa Telemedicine and Mind Spa Psychiatry here in South Florida. And I've been in the mental health field for about 8 years now. Like you mentioned, I treat a wide variety of psychiatric disorders using medication management and psychotherapy. I have experience in both inpatient and outpatient psychiatric care. Currently, my primary and most recent focus is telemedicine outpatient psychiatry.
Andi. Hi, Andi.
Andi, yes. I am a young professional. I am diagnosed with those conditions, so I feel like it's made me more of a mental health advocate. Mm-hmm. And related to this topic, it's just helping other people and spreading the word is very important to me.
Yeah, absolutely. You're a great representation of, getting treatment and doing better. And I'm really proud of you. So I'm very happy to have you here. Seeking mental health services has long been stigmatized as a bad thing, so people simply do not talk about it enough. Unfortunately, 1 in 5 adults in America experience a mental illness, and 1 in 25 adults in America live with a serious mental illness. Even though it is common, only 41% of people with these conditions get the help they need. There are many methods of treatment, but what is most important is that you or someone you know gets the help needed when symptoms of a mental health issue become apparent. Today, we will speak to both a patient and a provider in the mental health field to better understand the process of treating these issues in today's post-epidemic world. All right, ladies, let's start off with defining what psychiatric care is versus talk therapy, because I think people get confused about who does what.
So basically the difference is based on the type of professional being used as well as the approach. Mm-hmm. So talk therapy is typically done by therapists who focus on changing the way you behave, respond, interpret internal and external environmental factors that contribute to the way that you feel or act, versus psychiatry, which is practiced by medical doctors or nurse practitioners who focus on correcting the chemical imbalances associated with the symptoms, typically using medication or medical treatments.
Why do we think there's such a stigma with getting help for a mental health disorder?
So I would say that admitting that you have a flaw is really hard for people. Mm-hmm. So that would be the first thing, is admitting that you have something wrong, or it's not necessarily wrong, but it's just imperfect in a way. So admitting you have that and then going to get the help, it's a challenge.
Mm-hmm. Yeah, I agree with what you're saying, too. I think that stigma is really associated with like a lack of understanding, mm-hmm. Or fear. And because mental health isn't something that's easily visualized, people think it either doesn't exist or that it could be easily fixed. And when it can't be fixed, then there's something wrong with that person, right? Like the person thinks that they're flawed. So people tend to feel ashamed or embarrassed when it comes to mental health. And when it goes untreated, it typically or can get worse, mm-hmm. Just like any medical condition. So mental health is health. I always say that. And it's just as important as physical health.
What's interesting also is when I was first diagnosed, I feel like the psychiatrist was almost afraid to tell me, like, I believe you're showing symptoms of bipolar disorder. And it was hard, but I saw that I was on a mood stabilizer. So I was like, initially, like, I knew that was a possibility. But it should have been a very open conversation. She should have just said it right straight out instead of kind of beating around the bush.
Yeah.
I think too, I always tell my patients it's not even so much about the disorder, about like the label. I always say we treat the symptoms. It's not so much the disorder. So if somebody is coming in presenting with bipolar symptoms, kind of the excessive energy, insomnia, we're not necessarily treating the disorder, the label. We're just treating that insomnia. We're treating that excessive energy and kind of, giving them a mood stabilizer, not because they have something wrong with their mood, but to kind of target the symptoms that they're feeling.
So what are some of the signs that an individual needs to get psychiatric care? Like, Andi, do you remember what those initial signs and symptoms were for you?
I felt a really big sense of hopelessness. I definitely had really bad bouts of depression, and they would occur, and it was debilitating. And before I seek treatment, I remember calling out of work or just having a lot of issues. But the biggest thing was that hopelessness feeling and just feeling alone.
I always say too, when it comes to symptoms, if it's affecting something in your daily routine, that's when it becomes problematic. That's when it becomes a question for concern. So when you're calling out of work, it's affecting your work. It's affecting your job. Everybody, in a sense, has a little bit of, sense of anxiety. A little anxiety is good anxiety. In a sense, it helps you with test taking. It helps you with, getting through life. And everyone kind of has mild symptoms of this or that.
Right.
But when it becomes a problem where it's affecting something in your life, it's affecting your relationships, it's affecting your job, your academic work, your, anything, that's when it becomes concern. So I would say, in terms of signs where you need to get care is the first onset when you're starting to notice something. Sooner the better. Will be better outcome if you just kind of seek care if you're noticing that something is off.
Yeah, you said earlier that if the longer you wait, the worse the symptoms can get and the illness progresses.
Yeah, for sure. I think early intervention is key, just like anything. Diabetes, hypertension, all of that. Addressing it, getting good support system, getting a good understanding of what's going on is extremely helpful.
Yeah. So what is the process like of getting psychiatric care? And are there specific symptoms that the psychiatrist looks for when evaluating or anything that really helps determine, okay, this person needs this type of treatment or,
Yeah. So basically the first step is to make an appointment. The team will reach out to you. They'll kind of get a baseline. What are you being seen for? And you come in for a psychiatric evaluation. Basically, we start with assessing your history. We want a good understanding of your history. Have you tried medications in the past? Have you had depression or anxiety? Have you ever been diagnosed with anything? Have you seen a therapist? We get a good psychiatric history, and then we go into social history. Do you drink? Do you smoke? Do you drink caffeine? Because, of course, that can contribute to different symptoms as well. And then as well as medical history, physical symptoms, you always want to rule out any physical or medical concerns as well. And then we kind of go into screening different disorders. A lot of the disorders tend to overlap. So depression can sometimes overlap with ADHD, poor concentration, energy. Same thing with anxiety. Anxiety can also affect concentration and sleep. So the big things I would say is across the board for any disorder is assessing energy, concentration, appetite, sleep, overall mood in general when evaluating your overall mental health. And then that's kind of where we come up with the baseline during that initial psychiatric evaluation. We come up with a mutual agreed upon plan. Not every single person, wants medication, or not every single person, has the same idea as the provider in terms of what treatment looks like. And then from there, as we go, I tend to see my patients in the beginning a lot more frequent, monitoring that ongoing mood and, again, those components and kind of assessing it over time.
Now, after the epidemic, it's definitely been virtual, which is easier because it goes well with my schedule. They just call me. I do a pre-screening process every time. So they check how my sleep is, how my mood has been, if I have suicidal thoughts. So I still feel in the loop, which is good. I still feel like they're constantly caring. I don't personally do therapy yet. I have medication. I'm happy to say I'm starting therapy next Friday. So that's exciting. But the process is a lot easier doing it virtually just because I feel like you're less ashamed. You don't have to go in person. You're not worried about who's going to see me at this office. So I think it's more inclusive for people now so they can feel even more comfortable getting on the phone and calling these resources.
Yeah. I mean, they say sometimes that phone weighs 1,000 pounds, so I can only imagine that it definitely helps like lift the weight off your shoulders to be able to do it virtually. And it's not as demanding as having to find a time to fit into your schedule to drive somewhere to potentially see someone like you're saying. Did you have to meet with multiple psychiatrists at the beginning?
Unfortunately for me, the health system that I use, it's obviously in my network, so that's the reason why I went with them. I've been with them since I was first diagnosed with. I had been diagnosed with depression first. That was around 18.
Okay.
And I've seen them gradually go down in quality of care, but it's still because I see multiple psychiatrists and a lot of the pre-screening is done by medical students, which isn't a problem, but it's just like sometimes I don't know if I want to talk to like 5 different medical students. I know I'm not going to be talking to the same one next month. So it's difficult, but with the psychiatrist now she's been consistent. I've had her for the past year or so it's been good.
Yeah, that's really amazing. It's important to have consistency to build that relationship and not feel like you're having to start from scratch every single time.
And like retell your story each time. It's definitely important to have that continuity of care, that consistency with the trust building and everything like that. Especially just knowing from time to time someone's assessing you, knowing exactly where you started and your baseline. It's hard when another provider kind of jumps in the mix and
Definitely
wants to change up all the meds all of a sudden.
And I used to have like a great relationship with my past psychiatrist where I would text her like, hey, I have this issue, whatever, because going through the actual health system was a lot harder. So it was horrible when she left, and I was like, oh, now I'm stuck with whoever you guys give me. It's just, I'm at the mercy of them because you need the treatment, so you don't really care. You're like, as long as I can get my medication or my therapy.
But I think nowadays there is like a lot of different treatment options or like a lot of different providers. And like you said, telemedicine is so available. So I do think, and I tell my patients this all the time, even when it comes to therapy, really like finding somebody that you connect with is like super important because if you don't connect with them, you're not going to be honest.
Yeah.
If you feel like they're not listening, if you feel like you need somebody, it's like dating. Like I say when it comes to like, they have apps now where you can literally pick the type of therapy you want. If you want a male or a female, the age group, down to anything. And it like basically gives you like a list of providers that meet that criteria. Yeah. So I always say, if it's someone you don't connect with, find someone that you do. You know what I mean?
They should make like a Hinge app for psychiatric
yes,
care.
Yes, I agree. I think they should.
Put a patent on that.
Yeah.
You heard it here first on the Banyan podcast. What were you going to say? Sorry.
I do believe that. It's just this health system. Of course, they've known me since I was 18. But I also feel like people, when they have a mental health issue, it's so hard for them to even get to that point. Yeah. So they have to really push themselves. I'm especially somebody depressed. I'm like, the last thing I want to do is get on the computer and look for anything. So it's pushing yourself. It's a lot. It's, of course, on the psychiatrist or the therapist or whatever treatment option, but you have to push yourself to seek treatment.
That's the first step, right?
That's the first step.
Yeah. I think, though, once you start with a provider, at least they can help guide you in different directions in terms of like referrals and stuff like that. I have all of my patients see therapists. I think it's like super important to do both. I think there's like that missing puzzle piece when it's one or the other. Yeah. I think it's just a good team approach. Therapy always works better, or I should say medication always works better with the therapy component involved in it too.
How does therapy or medication help manage these conditions? I know you're saying that they work really good together, but like, do you have any examples of how they work together?
Yeah, I always tell my patients, and you'll hear me say that a million times. I always tell my patients, we can give you something for sleep or for depression, right? That's going to help fix that chemical imbalance or address that chemical imbalance. For example, if we give a SSRI, an antidepressant, it's going to help with the serotonin. But if you have a home life that is, or if you're doing something at home, like where you are not exercising, you're not getting out of bed, even though we're giving you a medication that's supposed to help with your energy or help lift your mood, if you're still kind of in the same thought process, the medication is only going to take you so far. You really need to be able to adjust the way you're thinking, adjust the way you're behaving. Medication isn't going to be a pill that fixes everything.
Yeah.
You know what I mean? You still might have a lot of environmental factors that contribute to the way you feel. If you're in a bad relationship, taking a medication isn't going to fix that, right? So taking a medication, but also having that supportive therapy to address some of the behaviors and thought process definitely contributes to overall mental health.
So like if somebody has depression, but they also get stressed out very easily, you know, when it comes to work, the therapy can help them with processing how they handle situations instead of just reacting and becoming depressed.
Exactly.
So the medication helps them, but trying to fix the trigger from occurring is even better.
Yep.
Got it. So we kind of talked about this a little bit. Andi, you brought up the pandemic and telemedicine. How has the pandemic changed the mental health industry?
The best thing to come about the pandemic has been the option of telemedicine, which allows us to see more patients who would typically not walk into a doctor's office to get help.
I would just say, I would reiterate that now I'm a lot more comfortable and it fits in my schedule. So I'm excited to also have therapy. I have a friend that has therapy over the phone and she's been doing it like that for years. It's the comfort of her own house. She doesn't like to get out, you know, so it fits perfectly and gives people the option to get the treatment they need, whereas before they were just not getting treatment at all.
Yeah, absolutely. I mean, I have to imagine business is booming, not even just for the psychiatric side, but the therapy side. I mean, I can't listen to a single podcast without hearing 3 ads for BetterHelp.com.
Yeah, it's true.
No, but I mean, as an outpatient, like telemedicine provider now, seeing patients on our end has become so much easier too, just because, you know, typically patients, even as a patient, when it comes to going to see my primary care or whatever, you have to make an appointment, then you have to get in your, or request for time off from work, because it's always 9 to 5 when the doctor's offices are opened, get in your car, sit in a lobby, talk to the doctor, get back in your car, go back to work. It's just kind of this whole to-do. Versus like now you can literally just go on your break, go sit in the car, talk to your provider, and then go back into work and continue business as usual. It's been completely amazing in a psychiatry standpoint, I feel like, because people, like you said, who would typically not get help are seeking care because it's just a lot easier and it's less embarrassing, even though it shouldn't be embarrassing. But some people are still embarrassed over mental health, which definitely shouldn't be. But I think it's also safer for the providers as well because, like, you know, I remember when I was inpatient, obviously that population's a little bit different, but there is sometimes patients do tend to have violent tendencies and stuff like that. We kind of don't have to worry about that so much anymore because we're not putting ourselves in front of harm's way.
Yeah.
Too.
And I know you said it's so much easier, but are there any challenges? Maybe it's not, you know, disadvantages like not being able to read somebody's energy because you're not in the same room with them.
Of course. I think the biggest challenge is depending on the severity of the case. I typically pre-screen patients before I see them to make sure that telemedicine is appropriate because telemedicine is not appropriate for every single patient. For example, schizophrenia or active substance use disorders. where they need closer monitoring, we need to check their vital signs. We need to, just do further assessments because of physical stuff. Some of the medications that we give, for example, schizophrenia can cause high blood pressure, weight gain, and so we need to be able to closely monitor that. So I suggest that depending on the situation, some patients do better in office just for safety reasons and for that closer monitoring.
So we typically see that mental illness can run in families. Is this something that can be passed down genetically?
Yeah, so some people may be genetically predisposed to psychiatric conditions. There are family links to certain disorders such as depression, bipolar, schizophrenia, as well as addiction, to name a few. But that doesn't mean if you have a family member that has one of those disorders that you're going to automatically get it. Mm-hmm. Like I said before, there is a lot of different factors that contribute to mental illness, environment, childhood, as well as coexisting medical and psychiatric conditions that kind of all play a part in mental illness. So
yeah. Andi, do you see that it runs in your family?
Yeah, my mom suffered from depression, and my dad was adopted, so he doesn't know his medical history, but I know he has bipolar disorder. He's not good about going to the doctor at all, regardless, so mental health definitely takes a back seat. But my mom was the first person to tell me, like, this is something that runs in our family, and you have to get treatment. Like, living with it is not an option. So she's pushed me for the first time to get onto medication and do therapy.
Well, I think that's great of her that she did that, because you have that support and somebody that's been through it and has the personal experience. So she's really able to guide you well.
I would say, like, why suffer too? You know what I mean? Like, there's so many treatment options nowadays.
It's true, because my friend will be like, well, I don't want to be on medication. I don't want to take a pill every day. And I'm like, well, speak to a therapist. Mm-hmm. There's other options. But being unhappy, and she's always unhappy, I'm like, you just have to do something. Something's got to give.
Yeah, exactly.
No, absolutely. I'm really glad that you brought that up, because obviously one of the main points of having this podcast episode is about destigmatizing psychiatric care and showing that, it can be successful. Like, look at Andi. She's a successful businesswoman. She works very hard every day, and she's living with these conditions. Like, it is possible. I think that a lot of people, maybe they were diagnosed when they were really young, 7 or 8 years old, and they saw a psychiatrist with their parents and they weren't medicated properly and they had a bad experience, and it's like they carry that on in their life, and then they allow themselves to suffer because they don't think that it works for them.
I think everybody knows somebody that is suffering. Yeah. Every single person. So it's just so common. What's my favorite saying? Therapists need therapists. Yeah. Everybody needs therapists. Therapists are great. It's just like nothing to be ashamed about, I think. Mm-hmm. And I think now we're starting to get to a place where it's becoming more acceptable, but we still have a long way to go.
Yeah, absolutely. So what are some ways to keep your mental health under control aside from medication?
Well, I would say definitely exercising. That's one of my biggest ways. I try to exercise at least 3 or 4 times a week. And I've noticed, like, the endorphins and the feelings you get, it's just... There's really, even the medication, it's great, but I still don't feel as good as I feel when I first leave an exercise workout. Mm-hmm. I think surrounding yourself with people that you really love, and just when sometimes your therapist won't be available, you send a text to your friend like, hey, I need you. Mm-hmm. I've had such a great support system the last 10 years while dealing with these mental health issues that you can't put a price tag on that. Mm-hmm. That support.
I would say also just like a daily routine in general. Mm-hmm. Like waking up, having like a purpose when you wake up, eating healthy, exercising, going to sleep at a decent time at night, having like a normal routine, I think is like very helpful.
Yeah, that structure, because then you don't feel so lost.
Exactly.
Mm-hmm. So what is some advice that you would give to someone who's currently struggling or has a loved one struggling with a mental illness? What would you say to them, Andi?
Seek help. Don't be afraid. The medication and the therapy I used to get changed my life completely, and I literally don't ever look back to a time before I seek treatment. It changed my life. That's why it's so easy to talk about, and it's so easy to tell my friends, like, hey, have you considered medication or therapy? I'm obviously not one to diagnose, but I see the signs in myself, in somebody else, and I'm like, there's no reason to suffer. Just seek help when you notice something.
And I would say too, like, even if you don't know where to begin, just seeing a provider, getting an evaluation, even if you're not even sure if you have something going on, but getting an evaluation, like, that provider can guide you, whether it's medication or not, or whether it's therapy or not, or, you know, whatever the case is, and then you can kind of build that support system. So even if you're mild right now, if for whatever reason it ever gets a little bit worse, you have, like, that support.
And especially when it comes to therapy, specifically talk therapy, I think it's so important for every individual to have one, just like you have a primary care physician. Because God forbid that day comes that you really feel like you need someone outside of your support system to communicate with on a deeper level. Just like we were saying before, it's so hard to find the motivation. It's such an overwhelming task to then, in a crisis, be out there looking for somebody.
I would say even psychiatry in general, doing routine yearly annual visits. Just, are you sleeping okay? Are you, how's your mood? Are you irritable? People sometimes don't even realize, like, or they think it's more of like a personality trait or whatever the case is. Again, but it's fine until it becomes a problem or it's affecting that aspect of your life. So just having like a little check-in never hurt nobody.
Marie, where can we find you if somebody is looking for a psychiatric nurse practitioner?
So you can always look up mindspa.telemed.com, and you could follow us on Instagram. I think it's at mindspa_psych.
Do you want to look at it real quick?
Let me double check that.
Well, thank you again so much for joining us today. And thank you, Andi, for your personal testimony. I really appreciate it.
Thank you.
Well, we hope you enjoyed today's episode. Remember that growth and recovery are possible, and it can all start today. Be sure to follow us on Instagram and Facebook at Banyan Treatment Centers, and make sure you're subscribing for notifications of new episodes. And please don't forget to leave us a review. If you or someone you know are struggling, call us today at 888-515-7706. Thanks for joining us today on the Banyan Podcast.